Good morning, everyone. I'm Mark Weeks on behalf of the Florida Alcohol and Drug Abuse Association. Welcome to today's webinar entitled First Responders Preventing Behavioral Health Risks with Mary VanHaute. This webinar is being made available through a collaboration of the Florida Department of Children and Families Offices of Substance Abuse and Mental Health and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode, and you will only be able to view your name. If you have any questions, please send them to the presenter and me, the host, by using the chat panel. The button to open the panel is usually located on the upper right side of your monitor. Please use the chat to send any questions you have as you think of them. The presenter will address questions as time permits. Our audio is broadcast through the internet to your computer. If you experience poor audio, there are a few options to try on screen right now, and these options are posted in the chat panel as well. If you continue to experience poor audio through your computer, try rejoining the webinar and use the I will call in option. You must be connected to the audio of this presentation and view it on screen as well to receive a certificate of attendance. The recording and materials used in today's presentation will be available on FADA's website within 30 business days. To access the recording and PowerPoint, go to www.fada.org, Resource Center, and to the training library. FADA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credits for webinars, workshops through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will direct everyone to an evaluation form on the FADA website. You will first need to register or sign into your account to complete the evaluation. Information you provide FADA as part of registration remains confidential. Statements of credit will be posted within 30 business days after the evaluation closes in individual personal development journals for persons completing the evaluation and attending the full webinar. Completing the evaluation is necessary to receive CE credits or to access your statement of credit. Do note that the evaluation will close at Monday on March 7th, 2022. Up to 2 continuing education credits are available for participating in today's webinar for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, be sure to include your Florida license numbers for reporting to CE Broker when you register with our site for the first time. If you are certified with the Florida Certification Board or licensed outside the state of Florida, you do not need to provide your certification numbers when you register with our site. Please note that WebEx monitors arrival and departures of attendees and provides a report upon completion of this event. We are not permitted to provide a certificate of attendance if you do not attend the entire webinar, and we are not permitted to provide partial CE credits. Mary VanHaute is a suicide prevention specialist, trainer, and educator. She is a master trainer with QPR Institute in Spokane, Washington, specializing in suicide prevention among law enforcement officers, firefighters, EMS, and other public safety personnel. Ms. VanHaute is certified in resilience training for public safety officers. And now I would like to welcome our presenter, Mary VanHaute, I will now turn the presentation over to you.
Thank you, Eric. I appreciate this opportunity, and I bring you all greetings from Clearwater, Florida, where I am on the College of St. Petersburg College, and I do training for the Center of Public Safety that is part of St. Petersburg College. So I bring you greetings from that area this morning where I live. Eric, I'm seeing your slides, so I want to make sure there's nothing I should be doing on my end. Thank you very much. Now we're moving along.
Okay, got this.
We are good. Thank you. Thank you. We are good. Again, thank you for your participation in this. And as your facilitator today, I don't feel I need to introduce myself any further. Eric had a little information. You can simply put my name in any search bar and find more than I care to share, but it'll be out there and you can find information about me. I do have to let you know that last bullet point, the Florida 988 implementation plan, I worked on the grant team. I was a temporary employee for a short period of time. The last 3 months, it ended in December, and it was a privilege to be able to work with DCF on a plan of implementing 988 throughout our state. But that did end as of the end of December. Everything else is alive and well in my life and work that I am doing that is listed there. But I come to you today as not someone well-versed or educated in suicide prevention, but rather as someone who has lived a life among first responders. And that includes a little bit of a photo journal there that I have up. That includes 6 generations of firefighters and most recently EMS, obviously, because firefighting in the early years did not include EMS. That dude with the glasses on and the black and white photo on top is my great uncle. So he'd been my grandfather. It's on my grandfather's side of the family. And he, over the generations, passed down this firefighting urge or bug within our family. And as any of you know, if you are involved in public safety or firefighting or law enforcement, many times it does run for generations. They call that a legacy fire family or a legacy police family. And then the color photo on the bottom right is both my nephew and my great nephew on the right-hand side. The one with the long hair is my nephew. And they represent those 6 generations of firefighting in over 100 years of fire service. I broke the mold though when I married a cop, and that's me and my husband there in the corner. And that was kind of interesting in my family because it was a sense of not only did I somewhat disappoint my father in not going into fire, EMS, nursing, I became a teacher. And then on top of it, I married a cop. But we joke all the time, must have been something going right or something worked because my husband and I will celebrate 44 years of law enforcement. And what that has done is it has given me, it has brought all my training, all my education to life, that lived experience, and to walk with and beside, to be loved and loved by first responders truly gave me the opportunity to take examples and illustrations into the textbook. And that's where I'm coming from today and where I'm speaking to you today. Life lessons are tough. We all have our life lessons. And I share with you something right now because I know that I'm not the only subject matter expert that's online today and part of this webinar. I know that there are others who have experienced that, who have lived that life and would have their own position or statement to make about this. But our family and the years and years of dedication to others and taking care of others, our world was devastated one day when we learned the suicide death of my oldest brother. He was the first in that generation to go into fire service. And when he died by suicide, our world did a sharp right turn in terms of how did this happen. I share with you right in the middle a family challenge coin. Challenge coins are big in the military and in first responders. And this family challenge coin has this mantra about providing for others and willing to take risk for others. My position as the one that's walked beside these people who take risks is, but how much risk will you take? How much are you willing to sacrifice? And I feel very strongly that there has to be a line in the sand. So you'll see me mention this or talk about pulling back, and they themselves can't see the line in the sand. And that's where we as companions, you as providers, can help them see that line in the sand. So I put that up as kind of a montage. The picture on the left is at my brother's funeral, and the helmet on the right was the engine company, and that helmet was passed down to his grandson, my great nephew that I showed you earlier. So this is where I'm coming from. Again, I'm not the only subject matter expert, and believe me, I feel very strongly there's nothing I can do about my brother's death, but there's so much I can do to prevent another. And that's where I'm grateful that you're with me and you're willing to participate in that progress toward making a difference, changing the trajectory. The course description, as you were given and is in the PowerPoint presentations, is basically just that we're going to work on understanding some of the culture that creates barriers to seeking help, and then some tips to minimize the barriers in a nutshell within all those first responder professions. And as far as the course objectives, it's basically going to follow into 3 areas that we're going to look at components that are embedded in the culture. They are embedded. And then address very frankly some myths and common misperceptions, and then end with some examples and strategies on establishing cultural competence so that we can better serve first responders and their families. So there's a lot of progress, but we still need to address barriers in these high risk, treatment resistant populations. And for me, as a family member and also with a degree in counseling, I see this as the intersection of their work and ours. The intersection of what they do and what you do is where we are right now, where more work does need to be done so that we can serve them in a better capacity. And also, I believe it helps in your understanding of your own behaviors and you as a helping profession and caretaker. The intersection of those 2 things can be helpful for everybody involved. A few logistics, as was introduced earlier, we're basically going to spend the 2 hours looking at 3 modules: an intro that we're in right now, and then to understanding the barriers, and lastly to bridging the gap. That 5-minute break that we will take will be at about the top of the hour. I have discussed with Eric, who introduced, there's a video about that time, so hang tight. It may be before or after the video, just so you know that that may be adjusted quite a bit. We will have opportunities for questions. I expect your participation. This is your learning opportunity, and know that resources will be at the end of the presentation. And I am always available and willing to chat, to sit down by phone, by conference, or meet you in person, the Clearwater person that's out there. Happy to do that. As part of this intro, let's take a look at what first responders are. You know, there's a lot I see lately about support our first responders, support our frontline workers, support our heroes. For the sake of this class, let's get a definition here. The American Heritage Dictionary says it is something such as this, but what I want to stress in terms of that definition is something that separates police, fire, EMS from other providers, and that is the words in this definition: urgent medical care and other emergency procedures, And then this verb, prepared to move quickly to the scene, then that makes me winnow it down a bit. So for example, in the box on the left there, I have nurses. If a nurse is part of a flight team and he or she responds by going to the scene, that would apply then as a first responder. Being stationary would not. I asked you to consider, does it include our volunteers, like our volunteer firefighters in our country, which by the way is 75% of our nation is staffed by volunteers. And yes, it obviously would include our volunteers. The military, well, if the military responds to other emergency procedures, goes quickly to the scene of a disaster, and they are trained in urgent medical care, yes. If not trained in urgent medical care, no. So see, we're really trying to just winnow down the definition here. And corrections officers, one of the most represented, misunderstood occupations that I know of. When I work with them on suicide prevention, it's tragic how few people know what they truly do in their world because they're pretty isolated. And corrections officers, and note that I don't say guards, they are officers. Corrections officers would be first responders if they are trained in urgent medical care and they move quickly to the scene of something, but if not, they wouldn't. So again, for the purpose of definition, we're winnowing that out. From my personal definition, first and foremost, they're people. They're your neighbors, they're your friends, they're colleagues, they're people in your social circles, in your faith-based institutions. They are there. And I would ask you, as you think about this, how do you define them? What is a first responder? Has what we talked about here made it more narrow? Has it heightened it, made it more acuity to it? And whatever you use to define a first responder, what formulates it? Where does it come from? And I ask that frankly because I know that many people form their definition of them without including the fact that they are first and foremost people, neighbors, daughters, sons, wives, children, parents. It's easy for us to do that. I get that. I very much understand that. But I also understand the other side, and that needs to be part of our perspective today and part of our definition. So I'd like to get your thoughts while you're thinking about that. And Eric will be bringing up a poll shortly and thinking about this definition. I'm curious with poll number 1, using that above definition, I'd like to know just how many do you know personally? And what I mean by personally is like, could you name them? Not like, oh, I think there's a woman down the street. I think there's a guy at a church. How many do you know personally according to this definition? So Eric, if you could load up that poll, I'd appreciate it. Thank you. So we'll take just a minute or two. Go ahead and indicate there how many you know according to that selection. A, 0 to 1, B, 2 to 5, 6 to 9, 10 or more. Go ahead and put your selection out there and submit your answer. And then Eric, you can close that poll. We really don't need that much time to gather everybody. Hopefully everybody had a chance. So if you could close that, Eric, and then the results. All right, taking a look at the results. I apologize. I had no idea there was this many people out there. So first off, my apologies that people did not get to the answers. What I can see though is by the answers that did come in that the majority of folks do know at least 2 people, at least 2. 2 to 5 was an answer based on the poll and the number of people who got to answer. And again, my apologies. I had no idea there were this many folks participating. The intent of this poll was for me to try to illustrate for you and for others that they are very much a part of our lives, very much a part of our world. And I think people sometimes would be surprised that there are over 900,000 law enforcement and corrections officers that serve our country, and there's over 1 million firefighters that serve our country. And therefore, they are going to be in our lives. They're going to be a part of it. In question number 2, I would ask you if you take a minute and put in the chat, and again, we'll just take a minute, so please think quickly and respond quickly. Put this into the chat. What one word would you use to describe a first responder? So very quickly, everyone, if you could put one word in there that you would use to describe a first responder. Coming in, dedicated, brave, selfless, heroes, rescuer, dutiful, helpful. Amazing, courageous, selfless. Thank you for that. And now let's switch to question number 3. In question number 3, I'm curious to know what you believe to be the leading cause of line of duty death. What is killing our first responders? One word, if you can. What would be killing our first responders in line of duty? Take just a couple minutes with that. Stress, suicide, depression, isolation, gunshot, burnout, substance misuse, trauma, suicide. Great. Well, we'll let some of those keep rolling in while I move into the next slide. And I appreciate the emphasis. It's obvious where you folks are coming from in terms of the internal wear and tear on these folks. Also, I do want to add to someone just putting COVID-19 and regulation, cancer, super. Let's look ahead. This is, again, for the purpose of framing up our presentation today, is to try to understand what truly is causing their deaths. And note that I'm emphasizing the word line of duty death. I asked that in the question, line of duty death. Since the start of recording line of duty deaths, historically, there's been a steady decline. Think about that. It's come simply from advances in safety and knowledge and training and education. In the last 20 years, there has been a decline, and there has been a strong emphasis on implementing technology and other things that work in favor of the physical safety of fire and EMS. I do have to say that fire and EMS differ greatly because of public sentiment toward law enforcement. You'll see more fluctuation in law enforcement than the steady decline that's come in fire service. Now, hear me out. A decline is good, but it is not good for the families of those who've lost. It's not. It's not disregarding that. I'm saying there's been progress in safety measures that affect this decline. I'd share with you that most recently in 2022, COVID has had the impact on line of duty death, because prior to it in 2019, I'm taking figures from 2019, in the fire service in 2019, it was the lowest number of deaths on record for our country. And in law enforcement, there was a significant reduction in 2019 in the line of duty deaths. Again, no disrespect to those who did die. But what I want to remind you of is that line of duty death does not include suicide. In no way, shape, or form, no matter where it happened, it does not include suicide. The leading causes of death for line of duty are medical, such as heart and stress-related issues. Cancer is also included in that medical, but cancer must be presumptive cancer. It assumed it became part of their life based on their work. Next would be accidents. And lastly would be assault against an officer, felonious assault, or fire, as in dying from a fire while on scene. My point being is we cannot consider suicide as a leading cause of death in line of duty because it isn't the line of duty. Therefore, we have a data dilemma. That last bullet point there. We have a data dilemma because suicide is not tracked consistently. It's not tracked anywhere consistently like line of duty death is. Line of duty death has to be reported. It's an on-the-job thing. So if suicide is not a line of duty death and is not something that we can compare to line of duty death, we have to be careful. I'll talk about it in a minute on why it is important to spread factual information, to present information in ways that can be supported rather than not supported or very fuzzy or gray. The data dilemma is that if we don't know how many have died by suicide in an occupation, well, then we can't really work towards reducing it. How do we know how to solve a problem if we don't know the scope of the problem? There have been progress in reducing those deaths in first responders that are both wellness oriented, as in heart. If heart attack is the leading cause of death, well, let's help educate on taking care of yourself and eating right and all these good things. If accidents, being killed on highways and rollovers of vehicles, large fire vehicles rolling over, well, we need to be educating about that. And it reduces the number of deaths. It saves lives. Personally, for me, I don't need the statistics on how many suicide deaths occur because for me, one is too many. And many of you might feel the same way. I don't have to know how many there are. I don't want them to happen, period. I don't need the statistics. So when I'm working with folks to try to bridge the gap between the services they need to not die by suicide and the services provided, the great opportunities, I speak about let's work towards that. The hard part is, though, we can't measure our progress. Unfortunately, it's hard to tell, where did it make a difference? The saves, how do we know? We just keep hearing about the deaths. But that's not reason to stop. It's encouraging to know that there's this many people on this webinar. I'm thrilled. If you could pull away one little nugget, it would be that we've got to continue to try to bridge that gap and pull together the services that are needed to save these folks from death by suicide to what you have to provide. And we can do that by normalizing the conversation, by having more conversations with folks that are real and are based in systems, support systems that are culturally competent, and we enhance and diversify the systems to ensure that they're culturally competent, and more importantly, that we separate fact from fiction, and we spread news and information that is based in facts. Therefore, things like saying, I see on social media, I see across many conversations, oh my gosh, more first responders are dying by suicide than in the line of duty, my first response is, according to whom? Who said this? And let's get to the facts of this. What really is going on there? Because we can't compare if we don't know how many were first responders who died by suicide, and you're comparing that to line of duty death, which is very succinct and precise. I'll give you just one example. Since 75% of our country is staffed by volunteer firefighters, if that volunteer dies by suicide, their occupation is not a firefighter. It's whatever they do by day or night, and they choose. They give up their self to serve their communities. It's not real clear, and therefore be careful when we pass on information that it's done with diligence and cited. I certainly want the mission today to be that you build that gap or bridge that gap with cultural competence by building education and awareness and enlightenment so that you have the ability to be culturally competent. And in a nutshell, that means that you as service providers, you as a mental health provider, are someone who has the ability to sit with anybody. That's what cultural competence means to me, that you're receptive to your client's lived experience, that you practice your craft and your skills, whether it's CBT, whatever it is that you're doing, through the lens of your client. And that's what builds our cultural competence. I'd like to share with you some local data, and this is an opportunity for us to see what is stopping our first responders here in the state of Florida from seeking help. So I'm going to show you briefly some results from a white paper that was done by FDLE and the Florida Firefighters Health and Safety Collaborative, which we'll discuss a little further at the end of our presentation today. And this is included in the First Responders Suicide Deterrence Task Force. That white paper revealed, first and foremost, over 50% felt that a barrier to prevent them from getting the help they need was stigma. Simply the thought that if they seek help, they will no longer be helpers, period. They can't help if they've sought help. And that's stigma, stigma is based in the word mark. It's a Latin origin of mark, and they feel they're going to be marked. That's where we really need to work as a society in that socio-ecological model to ensure that that mark is not a negative thing. Continuing with that survey, which again, you can find it in more detail. Down at the bottom, there's some things about lack of resources, leadership issues, the fact that they see services as reactive rather than proactive. Oh, here's another place we need to go. Implementing, and we'll talk about this in the best practice, that seeking out therapy is no different than getting an annual physical. We all agree on that. If you're not familiar with the Second Alarm Project, I encourage you to check them out. They're up in Tallahassee, and many of you might be. They have an ongoing research project that can be found at their website, which is down at the bottom there. From their ongoing research, they see that almost 50%, or 41, think that they can solve it on their own. Well, of course. They are helpers. They are problem solvers. They fix things. Those of you who have lived and loved with them, you know that that's the first thing they go to is a solution. They don't even hear you out half the time. Well, I can fix that. They are problem solvers. Therefore, that's understandable. I think it's worth noting that they feel they could be embarrassed if they can't solve it themselves. I think it's also worth noting, this second slide, that some of them had bad experiences with professional care. That's our opportunity. That's our opportunity to make this happen, to make it better. So I'm going to move into the second portion, ending this intro, and work into the second portion of our conversation today, covering objectives 1 and 2, which are to understand the components and identify myths. And I'm going to do that by taking intrinsic characteristics and extrinsic, the intrinsic things that they are, comes from themselves, and the extrinsic that comes from our society, or things we put on them as first responders and expectations of them. And note again, these are my visions, my recommendations. They're not all inclusive. They vary by profession. Some will tell me that firefighters are more receptive to therapy, for example, than law enforcement, et cetera. I'm going to share my perception on those differences. And it's my summation. Yours may be different, but I open it up for consideration today. So looking at some of the intrinsic things that are embedded in the culture that come from the person drawn to this profession. On the right-hand side, I believe that these are some of the common misperceptions because they've come to me, they've been told to me, they've been reported. I've seen them subtly involved in articles I read, or subtly presented in programming or presentations or trainings that I go to, that people believe first responders are very self-centered and they like to seek attention to their job and want to be that hero. And they have this pumped up self-esteem. And they should be familiar with resources because they are handing them out all the time. Okay, you go on an EMS call so you don't leave anybody behind, so they leave information, that kind of thing. Law enforcement's always asked to be part of our NAMI and all the other great groups that are out there because we want them to distribute the information. So they should know about it. On the left-hand side, though, they truly are quite altruistic and they don't like the attention. Again, not all, but the majority. They don't see themselves as heroes, just doing a job they love. And in fact, sometimes they struggle, instead of having high self-esteem, they struggle with a risk of the imposter syndrome. Am I really capable of this? Can I really do this? Until the call to duty comes in and boom, game on, they're good. They're good to go because they have those internal components to do it. And obviously, if they believe seeking help is a threat to their persona, they may be familiar with the resources, but they're not going to go. It's just not going to happen. So how can we build cultural competence? Learn more about behaviors that manifest from the threat of seeking help. Probably more common in someone that's being referred to services or as part of a fitness for duty, has to go for services. They're obviously more at risk for presenting with those behaviors because there's a threat in seeking help. I would ask you to be careful not to focus on their job duties or anything they've done, their experiences, unless it is therapeutically necessary. So in time and in place, it may come into part of the therapeutic plan to talk about something at work. But a watch out, just even for you socially and personally as you interact with someone. You may very well know this, but I reiterate it again. Calling upon a first responder, a police officer, or a firefighter, hey, what's the worst thing that ever happened to you? Like, oh, or ask something from the news, whatever happened to that, whatever, and naming an incident. Be careful, watch out. This may be one of the most traumatic things they've had to deal with, and they may be wrestling with it at this very moment with post-traumatic stress, and this is a trigger. And I find that personally, I saw that so much in my life with family members being asked that question, and I was the one to jump in and change the subject because they seem to be aloof, which is another aspect. This guarded behavior that is embedded in the culture might be perceived on the right-hand side, a myth, as a personality flaw. Oh, you know, that's the way they are. And they're in complete control. Oh boy, those people really got it together. And their family support is there. I see them with their families. Or they believe that the first responder should understand privacy laws and trust confidentiality. But on the left-hand side, their guarded behavior and their defensiveness often comes from occupational trust versus distrust. They need to always know, who can I trust? What is the safe part of this situation? They have a strong desire to protect their family from the world that they live in. And therefore, sometimes family systems don't get immersed in the first responder experience. They don't know because it's a risk. I think of my own experience. So my husband would come home in the morning after a shift, and how's your night? Fine, fine. Where's it going to start? And I'm off to work. And where would you start? I think they always fear a loss of control or a fear of retaliation on their career because they hold that career so closely and they are honored by that career. And losing control or fear of losing their occupation is so strong. Some more intrinsic components embedded in the cultures, they're mere overexposure to trauma, which is often overemphasized. People think that the job is full of this, and a little bit more on that later. They definitely have a skewed view of the world, and they have to trivialize suffering or trauma. They have an unhealthy relationship with death, period. They see it more often. I've not. They see more in a week than I will see in my lifetime. And thus, dark humor tends to come forward as a coping strategy. Unfortunately, the misperception is that people think, oh, well, they get rest between calls. They get rest. They have beds at the fire station. Yes, but environmentally, they don't get the rest that they need. And their view of the world can sometimes make them appear to be cynical or impersonal, insensitive, morbid. It is a coping strategy. It's a survival technique. And we can build cultural competence by considering the functionality of that guarded behavior. What's the functionality here? Just like when my 2-year-olds, my grandsons would throw fits, what's the function of this behavior? As I'd have to step back instead of reacting to it and weave that into your assessment and treatment plan. I ask you to consider how much of those myths are perpetuated by inaccurate portrayals in film or the media. No one is above the law. No one has a right to use their authority. No one against another person. I ask you, though, to think of the mass of people who do not make the media and how many of them are struggling because of those that did misuse their power, did wrong, broke the law. It's difficult, and we can work towards that encouragement of that group. And also what they call the CSI effect. My husband actually said that oftentimes in juries and trials, people thought that it was supposed to go like it was on television because they've been watching CSI, and it doesn't happen that way. So we really need to work on integrating realistic strategies for balance, mindfulness, and resetting realistic strategies. So if yoga is helpful, then it has to be presented in a manner like tactical yoga. It has to be presented as incentivized, that this yoga can be part of your work schedule. Yoga for first responders at the fire station, yoga for first responders as part of their recertification, etc. And I ask you also to be patient with dark humor. As growing up in fire and going into law enforcement, I saw difference in the dark humor. They're different. They come from different stressors. And I had to teach my children tolerance, to say, this is not acceptable, but there's a reason. And we learned together as my children grew and an understanding of that dark humor. We also can look at the myths and common misperceptions that, oh, they must be getting a lot of education and experience because they have to re-qualify, they have to train. But they don't train for soul injuries. They don't train for moral injuries. They don't train for unresolved guilt, unresolved loss. What happened to that patient they handed off to the ER? What happened? They don't know. The firefighter took the patient from the police officer that was doing compressions. Okay, moving on. Nobody gets educated or trained on that. because you don't know what it's going to look like. You don't know what it should be. People often think that traumatic events are infrequent on the job, but they are often occurring more than you think. But let's not disregard a component embedded in the culture, which is insidious trauma, insidious day after day, working with the underside of life. That's an inherent part of the profession, but it wears people down. The constant underside of life and interaction, not being able to change the world as they intended to do. People believe that there's a high divorce rate among first responders, but actually it is no higher than any other occupation where you don't have a regular schedule, or you're away from your family, such as truck drivers or long haul. I can think of a ton of different careers where that stress causes the same divorce rate. And people often think that all first responders work well together, but actually their workplace units are no different than our families. You can be close to somebody and not so close to others. They have a strong sense of belonging, though, needing to be part of their families, needing to be part of that workplace. So what can be done to build the cultural competence is, first of all, we have to move away from the concept that cumulative career stress is not important. It is. It shouldn't have to be one traumatic event. That could be, in fact, the precipitating factor. We need to understand the nuances, the different stressors that come from the different professions. There is, if you have a chance, we're going to talk about a best practice later in the next hour. If you have a chance to expose yourself to the occupations, you'll see a dramatic difference between EMS, fire, law enforcement, in terms of how they see what is stress. And they will laugh about it, they will tease each other about it, but they also have very different protective factors. Very different. Cops work alone, firefighters work in units, EMS work in units, they all work together. So we have to understand those nuances and differences, and don't meld them together when speaking to a police officer with firefighter or EMS types of things and so on. And also please acknowledge and honor the sense of identity that they receive from being part of a unit. And that sense of belonging, which we know in Dr. Joyner's theory about why suicide happens, if someone's removed from that or feels like they don't belong, it's huge. It is one of the factors that can lead to suicide and acting upon suicide. So be careful in anything that might threaten them as not belonging in some way, shape, or form, and remember that they're different among the professions. I'll cite this one example about the differences. Again, being raised in fire service and that sense of pride and things that swag and logos and things I still have some jackets from my sister in her fire service and so on, and my brother's t-shirts, things like that. Law enforcement, you don't wear swag. You don't identify. You don't self-identify in public. Fire, yes. I go down to the beach in Clearwater. I see people all the time from out of town wearing their, so-and-so fire department, because they want to belong. They want to recognize, hey, you on the job? Let's hang out together. Not so much in police. Does not happen because there's a threat there. So that is one good example of the different stressors and protective factors. Everybody wants to belong, though. They want to belong. They have a strong sense of belonging. So before we take a look at a film, I want to talk about this person, or this sense of the personal responsibility that first responders feel. They feel responsibility, and that brings on this fear that they may be the weakest link among the group, that they may experience guilt or shame on the job, being involved in an internal investigation, failure to follow procedures, being called out on the fire ground for not following procedure. It's very much a big threat. And they will often underrate or disparage their own pain. No, I'm fine, because they think nobody else is having trouble. Remember that survey we saw earlier? I can solve this myself. Doesn't look like anybody else is having problems with this call Why is this bothering me? And I can fix this myself. Time will heal. Well, they can't many times. We know that. And unfortunately, there's a misperception that, oh, they have team training, they share responsibility, they pat each other on the back, you're doing a great job. Or if they're not doing well, they can move on, try another career. Not so much. It would be very, very difficult. And anyone who has left first responder profession and not continued in the career can tell you that it's difficult. So we can build cultural competence by being empathic and staying alert for language or indicators that tell us there's terminal uniqueness or entrapment going on. That there's entrapment going on. And that's going to lead us to the next video, which will take us into our break. So Eric, if you want to get ready to cue that up, but I just have one thought I want to explain to you, this term terminal uniqueness. Terminal uniqueness is when someone feels they are so unique, nobody else can help me. Nobody else can help me. Not a peer, not another cop, not a firefighter, not another medic. Nobody can help me. That it becomes terminal. It leads to their death. And that's a term I've coined myself, terminal uniqueness. When there's no other option than to die, it's terminal because they believe no one else can help them. We have many opportunities along that route. So Eric, if you're ready to bring this up, I'd like to share with you Dr. Rory O'Connor, and he is from the University of Glasgow, so put on your listening ears to catch his accent, as he speaks about entrapment. And this will take us into our break. So as soon as this video is over, we'll take a break. I will respond to your questions in the chat. So whenever you're ready, Eric, go ahead. Are we ready, Eric?
Hello, I'm Rory O'Connor.
components. About a 5-minute break, we have some people to maybe reset and get back in also with the technical problems we had. See you back in 5. We are ready to resume. I did put out in the chat section, just so folks can see. I know there was difficulty with the video of Dr. Rory O'Connor. You can search out his IMV model of suicide, but I did put out in the chat, the reason I chose to include this was because of the total relevance to first responders. And I prepared or put a little blurb out there in the chat to help you see the connection, in that he speaks about the two key drivers toward acting upon suicide, of feeling defeated, trapped, humiliated. That those are things that commonly happen in first responders, not being able to save the world, feeling trapped in, I can't get out of this job, I can't turn around now, I can't quit now because of all that's expected of me, those types of things. And social perfectionism, that leads well to this next slide of what is put on them from the outside. They are very impulsive and risk-taking individuals, and sometimes it can be even exacerbated more by what the society puts upon them. And then I also listed as 8, he says there's 8 factors that are part of the volitional phase. And the ones most relevant to first responders are, first of all, access to means. Very quickly, law enforcement can access means. Exposure to suicide, they've seen how it works, what is better than others, etc. Impulsivity, that's what drives them. The go. Physical pain tolerance, that's very high because of all that they've had to deal with and put aside, shoved down. Fearless about death, it happens, death happens in their work. Imagery about suicide, again, they've seen it and visualized it. So check it out. It may be something else that you can take more time with at a later date, and apologies for the technical difficulties with it. So this last slide, there's just one more about dealing with our objective 1 and 2 about the myths and what we can do to build competence. And from the extrinsic side, the outside world, the socioeconomic model, socio-ecological model of suicide prevention from the CDC, what comes often down on them from the outside. Obviously work schedules, it has to be done. And sleep deprivation elevates the risk of suicide, and not getting sleep, even if given the time to sleep, doesn't come because of the elevated hormone levels, the cyclical nature, the hypothalamus won't let them sleep. And there is no opportunity for rest on the job often, and that carries through in home life. And believe me, it doesn't end at retirement. Now that there's time to rest, it still doesn't come easy. The public perception and misinformation about their job that we spoke about earlier, not having policy or procedures in place for mental health or crisis intervention services on the job. There's often many departments, you can survey them, and they have something on file for a line of duty death or an injury that happened from on the job, but cross the line into mental health and we don't always find it. And unfortunately, an extrinsic component that is embedded in their culture is their view of mental health is shaped by their work experience. When I speak and train with first responders, I tell them that's probably your greatest barrier to getting help yourself, is because you have seen those who need help, and it's difficult to put yourself side by side with them. It's difficult when you see the world in a snapshot rather than a video or a moving motion picture, to think that you also could be part of this. When I speak to first responders, I talk about that. So there's a misconception or perception that they have a chance to rest and that there are specialized mental health services on site, and generally there aren't. There aren't. There's very few specialties in service to first responders. And again, we'll talk about that shortly. So I'm going to encourage you to be an advocate for comprehensive behavioral health access programs and to immerse yourself in educational opportunities to learn more about them. And with that in mind, let me share some best practices and then open it up for a few questions. These are ones that I've found across the country, and I'll speak about one specifically here in Florida. that have some proven efficacy. I would ask you to check out the First Responders Resiliency Program in Texas outside of Dallas, where not only do they have peer support training, but building in resiliency tools and access to care that's at all levels of behavioral health. And notice that they have a clinician training program that's 6 weeks long. That's a commitment. That's an immersion, in my opinion. And I did have a video that I was going to show you from that. I would encourage you to go to the website, go to the YouTube video. It's cited at the end of our references today, and take a look at that so that we don't have to deal with any technical glitches to watch it on your own. Very powerful testimonies from first responders who have participated in the program and how they speak of the effect of the community and that social perfectionism on their lives. And I'm going to skip the poll also so that we can ensure we have time for questions. And I think we have addressed that poll. I think in the poll or the conversation we've had, your answer to poll number 2 hopefully would be along the lines of the stigma. The greatest impact on first responders not seeking is the stigma and the threat to their persona. So we will skip over this video. And let me share with you one that comes out of the state of Michigan and is oriented toward fire. There was a report done by the International Association of Fire Chiefs that said, it was called the Yellow Ribbon Report, and it was under the helmet. It was on a size up on mental health. Helmets, historically in the fire service, are designed to protect the most vulnerable part of their body, the head and the back of the neck from injury. And so it's ironic that they took that theme of under the helmet and said, we're going to be looking at the mental health, the well-being, the mind, the brain of these folks. And based on that report, the Yellow Rose campaign came out of Michigan Fire Chiefs Association, and actually came out of one fire chief in that state, West Bloomfield Township Fire Department, and they came up with a plan of actionable steps toward change so that they could move away from talking to each other or talking about each other and talking to each other. Moving away from talking about suicide and talking to each other about suicide. And doing a hardcore scrub and assessment of what services are we providing and do they fit? Asking the question, would it be all right if we pull out services that are provided by the municipality, by the county, by the state, pull out from that and do our own vetting, do our own process to assure that the care providers are culturally competent. And what that narrowed down to is on the right-hand side up there in the right-hand corner is they developed a challenge coin, similar to what I showed you in the beginning of the presentation, my family's challenge coin. And that challenge coin is titled and related to a program they call Give 55. They ask every firefighter in their city to participate in mental health assessment, 55 minutes once a year. It's not required, it's optional. Based on all the work they did, vetting the therapist, beta testing the system, sending 6 people through it to see, is it working? What could be changed? Do we need to, all those wonderful things. They did training to introduce it, training to all staff so they'd be familiar with what would happen when you go through therapy, what happens when you go into this office, etc. Very thorough. They didn't know how many would respond. They had an enormous response, and it caught on. It became their mantra, give 55, give 55 minutes. And the challenge coin they carry as a sign of silently being able to address this, bring it up, laying out the challenge coin, if someone laid it out, was a sign of, I need some help. I need somebody to talk to. I need some time. I didn't do well with this. There's much more to it, and I encourage you to take a look at it, but it's an example of, okay, let's stop talking about this, and let's stop talking about each other and gossiping, and let's take some actionable steps towards change, and they have a physical thing that identifies that. And this caught on, is all across the country now. You can see the Yellow Rose campaign in different states, Yellow Rose in various ways that has popped up in the fire service as the symbol, saying this is a department where we honor mental health, where you can go speak to anyone, where you will be free from the fear of stigma, you will be free from being chastised, and very relevant. And a question that's popping out here about, is it related to trauma-informed care? Many of the therapists that were vetted did have trauma-informed care, and they were grateful for that. Surprisingly, though, many of the people they vetted met the needs of life. I mean, the firefighters were going with concerns about family, children, finances, all those things we deal with in life. So the point is, yes, trauma-informed care is important. Absolutely, they needed those folks on staff, but they also then specialized or found folks that were dealing with life issues, and very specific in that. Here's one that's in our state, the Second Alarm Project in Tallahassee. I showed results from their survey earlier. You will see this behavioral health access program, a BHAP term, out there in literature, and you may hear it presented at conferences. That's their mantra. That's their goal, is to move from employee assistance to behavioral health access, moving from a standalone program to immersed behavioral health care. That includes leaders, leadership development on how do we include those who are writing the policies for our city, those who are enforcing human resources contracts in our city. How do we get everyone involved, not siloed into EAP? Vetting the providers, again, trauma-centered care, as was asked before, trauma-informed care, having very seamless access to care, no wrong door. As we've heard over and over again in the mental health profession, no wrong door. There's seamless access to care. Making sure it isn't a radio button on a website, it isn't a phone number that you call, it's seamless access. And ensuring that any natural support system is there. First and foremost, what is the most natural system for the officer, the medic, the firefighter? What's the natural support system, whether it be a faith-based, whether it be family, whether it be peer? Where do we start? There's no one size fits all. And moving away from EAP to BHAP, you'll see this in our state. Something else I feel very, very strongly about and want to encourage you, if you haven't heard of this yet, is the Florida Firefighter Safety and Health Collaborative, which is statewide, and then Blue Line Rescue, Red Line Rescue, which are also statewide. They offer a clinician's awareness course that is 2 days of training, 16 CEUs. It does require 10 hours of ride along after you complete the course. So if there's anybody out there listening that has gone through that could testify to this, please do throw it out into the chat. But an example of this type of course are folks that I have had in my suicide prevention training, clinicians or others that are support, like chaplains, etc., who have gone through this, who say, eye-opening in terms of not only what we're talking about today, some of the humanity, the human element of this, but they actually do go through training. They do go into a burn house. They go into these experiences. Now, mind you, this is only for fire, and citizens academies and things like that in law enforcement were very common pre-COVID, and also the other factors affecting law enforcement, the social factors right now, the anti-police sentiment is certainly a risk, and things such as the mere shortage of people. There's an employee and employer issue right now where we don't have enough law enforcement, we don't have enough fire, and therefore finding someone who can do a ride-along or be a ride-along host is very, very difficult. So I do know that in the fire service, this is well received and clinicians have been very happy with it. I can tell you the next one is down in Bonita Springs, which is the southwest side of the state. It is April 6th and 7th. And if you are interested, I'm going to put the contact person in the chat, and that person will take information, send you information if you are interested in being a part of that. Her name is Kay Rogers. And if any of you are from the Midwest, this looks like Kroger's, the grocery store. Kroger's, Kay Rogers at floridafiresafety.org for more information about the next clinician awareness course. One other best practice that I can tell you about comes out of the Crisis Center of Tampa Bay. You may or may not be familiar with this number, 866-4FL-HERO. They have a campaign called The Last to Ask for Help. They're first in, but last to ask. And therein lies a huge dilemma. Therein lies, again, as I spoke in the beginning, our chance, intersection of your job and theirs. What is making this effective, according to the folks that are using it and utilizing it and providing it, is that peer-based support. It was modeled after the Veterans Crisis Line, and therefore having peers, which is successful with the Veterans Crisis Line, is the opportunity there. The fact that a firefighter or law enforcement or medic wouldn't speak to another firefighter, medic, law enforcement, because they're fearful of being seen as weak. They're fearful of being felt trapped or defeated or humiliated. Speaking to a complete stranger may be helpful. Now, making a phone call is often difficult. There are many different apps that are out there right now for texting and seeking help. I don't know what the magic answer is. I don't know what is perfect. But the more of these we have, the more options we can give to someone, the better. So they have great resources for first responders and for those who support it, the Crisis Center of Tampa Bay, again, the host of this. So I'd like to open it up for a few questions before we take this poll. And then I'm going to close today with a video, a documentary. It's a short documentary, but that will take us a little bit of time towards the end. I'm going to save this. So please, if you would, throw any questions out there right now or comments related to anything that we've covered so far, such as the data back in the beginning, building cultural competence, some best practices. I will hold to wait for some of those questions. Okay, we're looking for, someone's asked about a resource sheet for first responders, counseling, treatment, etc., and forward that in email. I will do that. So the resource sheet, there's a question that would be for first responders to hand out. Okay, so it looks like some people are focusing in on the poll question right here. So let's go ahead and do that. If you would take a look at poll number 3, I'd like to know what's one action step that you can do to build cultural competence with the first responders in your personal or professional life. If there's anything maybe you've taken away that changes how you might interact with your neighbors, friends. Someone else is also looking for outpatient clinicians. A question about outpatient clinicians with cultural competence. There are several resources for that, such as the Red Line Rescue that I mentioned earlier. The Red Line Rescue has on their website people who've been through the training that I mentioned, that 2-day training. You can also find on the Second Alarm Project's website vetted counselors who have cultural competence, and it lists exactly what insurance they take. So in answer to a question that's out there, outpatient clinicians with cultural competence, there are 2 sites, the Second Alarm Project and the Red Line Rescue, that have resources showing vetted cultural competence and what type of insurance they take. I'm just going to give it another minute then to answer this question. What's one action step you can take? One thing. We can sit on our hands, we can keep thinking about this, we can keep wringing our hands.
Mary, I wanted to remind you that the participants cannot see the other participants' chats, so you may want to read some of them off.
Thank you.
You're welcome.
Just a reminder, there isn't a poll, it's to put this in the chat. And many of the answers deal with as simple as asking, how are you? Developing more insight, do a ride along, participate in the services and these programs that are available. Some of the others, peer support, develop peer support. Yeah, I'm seeing a question. I want to go back to this one. If a first responder is Baker acted, isn't that interesting how we took a noun and turned it into a verb, but we all do. Baker acted. Does that threaten their career and ability to continue their position? It truly depends on the, first of all, I have to be very broad because it depends on the state. There are some states that, in the state of Illinois, for example, they just recently changed the legislation that being in a mental health facility causes you to lose your ability to carry a FOID, firearms ID card. They've just recently changed that. I don't have a very specific answer for you in regarding does that threaten their career and ability to continue, because there's so many issues that may be related to the reason they were Baker acted that may affect their job. But that single act itself should not. So I can't clearly answer the question, does it threaten their career and the ability to continue in their position? It truly depends. Whatever the factors were that may have led to that Baker Act could be the reason. And that's why we have to be careful. For example, I hear often in my trainings when I ask the question, how many of you know someone who lost their job because they sought help? They sought help. And oh, hands go up. Oh yeah, this person sought help and they lost their job. Well, later on, I may learn more. It wasn't the seeking help. It was the behavior that led to the need to seek help and so on. So I'm just asking you to have a perspective in that manner. And I would love to have a discussion about that offline. Anyone else that has that, feel free to email me. We can go back and forth. We can talk by phone to get clarity and acuity on that. All right. I like the comment. There's a comment on here about our volunteer fire departments, that they're a forgotten lot. Oh, I hear you. I hear you. There is very much a group that, and they also are suffering from staffing issues. They can't get enough people. They just can't get enough people. And so they give up a lot. And most volunteers are serving their own constituents. In other words, they're going to respond to family and friends, which still can happen, obviously, in large departments, but not as frequently. And thank you for the person who put out the information. Shield Us. There are other law enforcement support groups in our state that are very good too. All right. Be empathic. Thank you. Let me move you into this to close out our presentation today, and I will open up for any comment further after this. Eric, if you want to get this queued up, I close this for you close out with this, folks, so that you can have an idea about a best practice in bridging the gap where one person, one individual, his name is Aaron Johnson, a filmmaker, a graphic artist, he was able to take some actionable steps to save lives. So I present this documentary to you. It is 9 minutes.
Why are you making this film? Last year.
Mary, I'm not sure what's going on with the videos, but I don't know if you want to continue playing it or if we should stop it.
Hardest thing I ever did. Hardest thing I ever did. Get over a gun.
All right, we are obviously struggling with some technical difficulties. And I appreciate the support from Mark and Eric with the state as they're trying to work through this. I will summarize this for you. I can't do as good a job as this author did. So I'm going to encourage you when you leave today to go out and take a look at that video. In a nutshell, Aaron Johnson, who's a graphic artist and works in the city of Milwaukee, he saw and I won't say an active suicide attempt, but he saw people on the bridge, the Hone Bridge in Milwaukee, that's the name of it, and thus the spin on the film, Hone Alone. And it compelled him to say, why is this happening? And he did research, worked with Mental Health America of Wisconsin, which is based in Milwaukee, and did research and was driven to create this short documentary. It's a short film, and it was entered in film festivals, first at a state level, in Milwaukee, and then it went on. It was so well received in the way it presented a message of hope, and that every one of us has a responsibility to suicide prevention. I won't tell you everything about it, but it includes a first responder in the video who is interviewed as to what they did on scene. And it is, as you can see, it is not, it's a caricature because he's an artist. So the caricature is the way this is presented. Doesn't have any triggers. I say that cautiously because I don't know what each person's triggers are, but there's nothing extremely graphic or disturbing about it in my experience as a suicide prevention specialist, and my goal to be conscientious and responsible in spreading the word. I can tell you that I got involved because as they were doing this production, someone mentioned my name, and I wasn't even anywhere near Milwaukee, but the author of this documentary reached out to me and asked about my willingness to participate. And sometimes I'm asked to do a film screening of this, and people ask about how I got involved. So I'll just shortly tell you that I hesitated because, like everything else, all of you who know how difficult it is to be vulnerable, I had to be cautious of the number of people that were affected by this that I don't know. You know, there was some old data out there one time that said for every suicide, 6 people are affected. Well, current research says that's about 135. And so if there's a very public suicide involved, which was the case of my brother's death, how do I know? So I was very cautious and got clearance from everyone I knew who would be infected in my family, including my brother's family. And then agreed to do the interview. So there's a part at the end that you will see more about our family story, more about what resulted from that. And as in anything else in life, we learn and we adjust and we adapt and we do all that we can. I'll go back to my statement. I can't do anything about my brother Charlie's death, but there's so much I can do to prevent another. So it's a bit anticlimactic to end this way. I was hoping the video would stir up some thoughts, some interest and questions. We'll just have to extend it and adjust. And I ask you to consider watching it. Please take the time to do so, and then send me any questions or comments you might have by email. And other folks watching today know me personally, might be able to help connect you with me if there's a way that you'd like to talk to me in person.
Mary, if you'd like, I could give this video one more try.
Oh, okay.
Okay, give me just 1 second.
Okay. It's going to cut into your time.
Second.
Yeah, I think we should proceed because I
Okay.
need to show the references and so on here.
All right.
I will wrap up by asking you all again to consider what we talked about in the very beginning about building cultural competence. And building cultural competence, it's relevant in everything. I've been intrigued lately in getting more education about the rise of suicide death among young African-American males. And in doing that research and sitting in on webinars and great trainings, trying to understand something that I can't experience. And I ask you to take that same level. It applies in every client you see and every person. We may not be able to understand, but we can attain cultural competence by seeing it through their lens, by being forthright and honest, and allowing them to be vulnerable, particularly first responders, to suspend our judgment of them being superheroes and allowing that vulnerability to take place. and see it as part of that process in their growth and their return to the job stronger, healthier than ever before. So a couple other resources that are out here. Again, these are in your materials, but the Red Line and Blue Line Project, those are the ones that I said have the vetted therapists. So also does the Second Alarm Project, that first one on this site. Feel free to check out the task force annual reports. Got lots of good stuff in there too, as the task force works over a 3-year period to try to make changes at the state level. Got our resources here. This YouTube video from showing Melissa Franks from the DeSoto, Texas Police Department was the first one that I skipped over. And there is a video on the cultural competency course that's taught. That was done in Orlando. And other things related to firefighter fatalities and law enforcement deaths. These are the sources I have for that. So I will turn back to Mark. I know that you have some wrap up, but we do have about 2 or 3 minutes for any other questions that might come through.
Mary, could you go back one slide? You didn't have the ball at the time, so if we could just get that up there for a moment and people can see that, that'd be good.
This one?
Yes, thank you. And if anybody has any questions, that'd be good. Otherwise, Mark can.
There's a question asking for a PDF of the training.
Okay, yes, that will be, I will get that up in just a second here.
So
But
questions?
we'll give 30 more seconds for Q&A, and then we'll begin the wrap up.
The PowerPoint will be available. It is available in a link that it's even up there right now. If you can scroll up in the chat, you'll see it there. And a PDF of it is available. The PowerPoint.
All righty. Yeah, it looks like a lot of the questions coming in are related to the administration and just finding things again. So
All right.
we do host a number of webinars. Check out our website at fata.org. On a wide-ranging subject. We'd like to thank Mary for presenting today. We have included Mary's contact information so that you may contact her with any further questions. Mary, again, we'd really like to thank you for all the work you put into this webinar and all the valuable information you shared with us today. Please note a couple of items before we conclude. Please see the chat panel for a link to today's survey. Additionally, when I conclude today's webinar, your browser will take you to an evaluation on FATA's website. If you want to receive CE credits or a statement of credit for this event, you must complete the evaluation. You will be prompted to register or sign in to complete the evaluation. You can register as a visitor at no cost. For CEs to be reported to CE broker for FLA licensing healthcare practitioners, you must provide an accurate Florida Department of Health license prefix and number the first time you register. After you register or sign in, you will be directed onward to the evaluation. You must use the same email address you used when you registered for our webinars and when you set up the profile in FATA's system. This is the only way to connect your attendance and your profile. You will get a second opportunity to complete the evaluation through a follow-up email later today. The sender will be messenger@webex.com. The evaluation will close at midnight on Monday, March 7th, 2022. We do not email statements of credit. Instead, after we verify attendance and completion of evaluation, a statement of credit will be generated as a journal entry within your profile 30 business days from today. After the evaluation closes, excuse me. Thank you again for participating in today's webinar. We'd also like to recognize and thank especially the Florida Department of Children and Families, Offices of Substance Abuse and Mental Health for funding today's education. Have a great day and please hold for your evaluation.